Hello, everyone. My name is Katerina Warburg. I am a founder at LTN, and with me is Victoria Ertl Garcia. She is a founder of Vici Coaching.
Yes. So hi, everyone. As Katerina said, I'm Victoria Ertl Garcia, and I'm the founder and CEO of Vici Coaching, which is a coaching program that I've set up to support adults with ADHD, specifically with their communication goals. So I want to help any adult with ADHD work with their brain and not against their brain to become a stronger writer, public speaker, and just overall more confident communicator.
No, I think that's so helpful because, like we said, no one really talks about it. I feel like there's a huge misunderstanding of what ADHD is. So, at a base level, what exactly is ADHD, and what are like the classic symptoms for it?
Yes, I'm glad we're starting there because there's so many, rumors and myths to dispel surrounding ADHD. But at its most basic, ADHD stands for Attention Deficit Hyperactivity Disorder. So it's a neurological, neurodevelopmental condition that will affect someone's, attention span, their focus, their ability to start or finish or shift between tasks. It will also affect their impulsivity. And I want to just, briefly pause and say, like, as humans in general, we all deal with all of these things from time to time. We all make impulsive decisions on occasion. We all daydream and, forget to do something, right? But the thing that kind of sets ADHD apart is that it's something that happens so consistently that it will affect someone's everyday living. Now, I'm not saying like all of these symptoms will affect you all the time, but there will definitely be enough of them present often enough that it's, something that you need to go get diagnosed for or receive some sort of help with. Mm-hmm. So the three major categories of ADHD are the hyperactive type. So I think this is the type that people are most aware of. Then there's the inattentive type. So this used to be called ADD, but sort of language is no longer used. It's just ADHD, inattentive type. And then we have the combined type, which, as no surprise, is just a combination of hyperactivity and inattentiveness. In terms of the symptoms of ADHD, for inattentive type, we're going to look for things like daydreaming, lack of focus, forgetfulness, issues with object permanence. So a great example is like if you need to do the laundry and you need to fold your clothes and put them away. If your laundry basket is not right there in front of you for you to see, you're probably going to forget it's there. And then that often leads to a lot of unintentional procrastination because you just keep forgetting the laundry even exists. So that's very common for people with inattentive ADHD. And then for like the impulsive side of it, that can be, just acting out of or without prior thought. That can be often getting burned by, hacks or like little tricks that you try to make up for yourself in your daily life that don't always work out for you. And then hyperactivity is just being oftentimes physically fidgety, someone who likes to bounce their leg a lot or bite their nails, they're always on the go. They're always chasing the next thing, the next goal. They have a hard time kind of just sitting, relaxing, being in the moment. But I think it's also really important to point out that hyperactivity doesn't always mean it's like super physical. It can also manifest in sort of internal ways. Like I said, always traveling, for example, if you can afford that because you don't like staying in the same place for too long, or, just always overloading yourself with tasks in work and school and at home because you just don't want to feel bored and like boredom is your enemy. So that's generally speaking what ADHD is and the most common types, but we can definitely get into more of like the nitty gritty.
Yeah, I feel like if you were to talk to anyone, it's such a common terminology that I feel like everyone's like, oh, I have ADHD, but people say that without necessarily being diagnosed. But it's interesting because a lot of my Latin friends say it like much at all. It's a vernacular you don't hear. Mm-hmm. What is how does it differentiate with women of color specifically or within the Latin community?
Yeah, so that's a really great question. So honestly, the symptoms themselves, so whether you have trouble paying attention or you are very forgetful, things like that, that's going to be something that doctors, psychologists are going to look at across the board, regardless of your, demographic qualities, like if you're a man or a woman or if you're white or a person of color, like they're going to look for these signs for everyone. But the way that it can differ based off of who you are as a person is in how these symptoms present themselves, because of the way that we're socialized. So it can be really, important to have doctors who are culturally competent, who know of what to look for, so that we can make sure that everyone who needs to get diagnosed actually does get diagnosed. So an example I have of this is actually the very first person I ever met in my entire life who had ADHD was a boy in my second grade class. He actually joined my class at the very end of the school year, like 2 weeks before we were about to get out of school. And I remember before he joined the class, my teacher, was kind of explaining ADHD to us in a way that like 7-year-olds would understand. And she was like, he might be very fidgety. He might like get out of his chair sometimes. Like, it's okay. It's just how he is. And so I remember like one time he got in trouble for getting out of his chair when he shouldn't have, and, going to stare out the window. And then another time he got in trouble for drawing on the shirt of one of his classmates, because he's like invading their personal space. And I remember like at 7 years old being like, wow, like he's really acting out, blah, 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 not knowing the entire time that I had the same condition as him. And that's because my forms of hyperactivity, of inattentiveness, all of those things just weren't being picked up on. Like, I had socialized, to be a good girl, to be quiet, to really control my body, like hold myself in and not, physically burst out, things like that. And so teachers never picked up on me fidgeting at my desk. They never noticed that I was daydreaming, things like that. So I think that just kind of highlights how, even if that guy in my class and I have the same symptoms overall, the way that they're presented and interpreted by people can be very different.
Yeah, and actually someone in the comments literally just wrote, is it true that it's harder to diagnose women?
Yeah. Yeah, I see that question. And yeah, honestly, it shouldn't be that way, but sadly, currently it is, because of what I was just saying, in terms of how it's interpreted and perceived. It's said that women are diagnosed at less than half of the rate of men. And that's even less if you're a woman of color. And on average, women aren't diagnosed with ADHD until they're in their late 30s or 40s. And a lot of times, women won't be diagnosed until their children are diagnosed. And they'll go to the doctor will describe like all of these behaviors and symptoms, and then she'll be like, wait a second, that sounds a lot like me. And it's like, ding, ding, ding. Yes, that's probably because you also have ADHD and your child probably got it from you. So yeah, it's definitely, unfortunately, at this point in history, harder, but that doesn't mean that we're not making significant strides in improving that.
Yeah, so I guess with that being said, is what actually causes ADHD? Is it something that you are born with, or is it something that you kind of inherit based off of your environment, or is it, I guess, nature versus nurture? Do they know?
Yeah. So, I mean, they're still always doing research on it. Right now, the research is predominantly saying that it's just a genetic thing. So, again, if you have it, then there's a good chance one of your parents, if not both of them, or your grandparents has it as well. That's why, a lot of times what will also happen, like in my example, I got diagnosed and then my parents were like, well, everyone does that. And I was like, I don't think everyone does. I think we're just all used to acting this way. Yeah, so that's predominantly how it's passed down, but there is more research suggesting that it could also be factors like when your mother was pregnant with you, did she consume alcohol, or were you exposed to other harmful things like lead? The research on that is still very much in progress, and so we can't say definitively that's another cause, but it's looking like it could also be partially nurture as well.
Yeah, it's such an interesting thing because obviously you could inherit it. And for women specifically, I feel like you're like, for me, if I act a certain way, like I'm told very quickly to like present myself well. Like I need to, there's an expectation of how women or girls should act in the community versus the boys. So if we were to act up, my mother yells at me right away. And it's just interesting because then you're kind of, there's this you're embedded to kind of be like, oh, I need to, like you said, I need to be organized. I can't show that I'm like struggling with that productivity, or that my fidgeting is more of an annoyance to people, and then I'm getting kind of like insecure about it. And it's just where I feel like for men, it's very much like, well, just guys being
boys. Yeah, exactly. Yeah, I think you bring up another really good point because, I think a lot of times when we think about ADHD in boys, as we just mentioned, a lot of times we're like, oh, that's just how boys are. Like, it's fine, But also, I think, if they don't do well in school, for example, because maybe they're super forgetful or they just can't focus on a task, a lot of times we'll be like, oh, well, that's just because they have ADHD. And like, we don't expect or hold them to the same standard, which is also still kind of unfair. But then with girls, it's like, you could have ADHD, but you're still expected to do super well. So
yeah.
you could still be a really good student, for example, but the amount of mental effort that it takes to, perform at the same level as your peers can just be really mentally and emotionally, sometimes even physically taxing on you. So just because you're successful, with ADHD doesn't mean that, it's coming to you easily, especially if you're not afforded the same kind of understanding or resources that, other students might have.
Yeah. For a woman, sorry, I'm just going through our questions. For a Latina speaking to another Latina that might have ADHD, do you have any kind of tips and tricks to kind of cope with it or recognize it, or even kind of, I guess, reach within your community to kind of ask for help?
Yeah, for sure.
Yeah.
So I think, in terms of tips for coping with it, if you don't actually know if you have it yet, I think just doing research on it, so looking at blogs, especially blogs written by other women of color, other Latinas, for example, who have ADHD, can be really helpful because they can really clue you in on the different signs and symptoms that you might have been doing your entire life, but just never really recognized as potentially being ADHD. And then if you do know you have ADHD, I mean, there's, several things you can do, like medication is a common route. But of course that has its own issues with like accessibility in terms of, sometimes these medications literally just, there's a shortage. Other times they're just really expensive, especially if you don't have insurance. But, if medication is an option for you, like by all means, don't be ashamed to try it. Therapy can also be a great thing as well. But if you're looking for other, coping strategies, I mean, there's so many things you can do. So like, for example, I am really horrible at remembering the times that I need to do things, like, appointments, this call even. I set so many alarms, and that really helps me because without that, like, who knows how many things in my life I would accidentally miss out on, right? So I think just recognizing the ways that ADHD affects you in your day-to-day life and then coming up with, easy solutions to that. Or what I said earlier about like object permanence issues. So like if you're someone who constantly forgets that you need to do something because it's just not right in front of your face, then just try to find ways to make it very obvious to you as you go about your day. It could be like putting sticky notes everywhere, or again, setting an alarm so it, jogs your memory, things like that. There's definitely so many things you can do to help yourself. Another great way to get support is by joining, like on Facebook, they have a bunch of ADHD women's support groups. And so you can often go in there, pop in a very specific question, and you'll just crowdsource like so much advice related to your topic. So that can also be a really great and free support system as well.
Yeah, I know one thing that I have, because I call it productive procrastination, where I will put the object in front of me, but I will look at it for days and I won't touch it. And instead I will productively procrastinate and do everything that I need to do that is not that one thing.
Yep.
And so like, let's say when it comes to like cleaning my apartment, there are apps now that will kind of have you break up that task so that it's less big in your head. Because once you're like, oh my God, how am I going to spend my whole Saturday cleaning? Then I feel like your anxiety gets really bad. And it just builds up, and then all of a sudden you're just like incapable of doing anything.
Yeah.
That's like my experience. And
no, that's super common. And I don't know if I mentioned this already, but just, the energy it takes to start a task, even if it's something that'll take you like 10 minutes. Sometimes we just play it up in our head so much that we can't even get started on it. And then once we finally do it, we're like, oh, that really wasn't that bad, you know? So like you said, resources that help really break down tasks can also be realized like, oh, this really isn't as big or overwhelming as I thought it was.
Yeah, no, definitely. So Glenda in our comments has asked, are there different levels of ADHD to the point where someone is not diagnosed because their symptoms are not so obvious?
Yeah, so there are sort of levels, I guess you could say, in terms of like, you know, more mild forms of ADHD and then more severe forms. Um, but if it's so mild that it can't be detected or diagnosed, it could either be that one, you just simply don't have ADHD, or you might have another sort of neurodevelopmental condition that is often similar to ADHD. So a lot of times, actually, people will really have bipolar, not ADHD, and it gets kind of tricky, you know, diagnosing and differentiating between the two. So that could be one option. The other option could be that you genuinely do have ADHD, but as I was saying earlier, it's not even so much that your symptoms are mild. It's just that doctors might not be able to pick up on your symptoms because they might not be as informed as, you know, they could be or should be. I don't know if I talked about this already, but the first time I was diagnosed with ADHD was actually back in 2020, and it was with a white male doctor who diagnosed me as inattentive type. And at the time, I was like, oh yeah, it makes sense. Like, you know, I've read about the symptoms. That sounds just like me. So I kind of took it and I was like, yep, this is cool. And I left it at that. But actually, earlier this year, I was participating in this study for adults with ADHD. And the doctor in charge of that study, she's actually a Black female doctor. And she re-diagnosed me as combined type because she knew the things to look out for. She was the one to tell me, like, girl, you're traveling all the time, and you can never sit still. You're involved in so many different things. Like, do you think that means something? Like, hint, hint, you have hyperactive symptoms as well. And I just think that that also just highlights the importance, you know, for diversity in the medical field. But all this to say, you know, it could be one of two things. Either you really don't have it or you do, but maybe the person you're working with just doesn't know how to work best with you.
Yeah, I think you bring up so many great points. I think one, if it's not a hindrance on your life and your lifestyle, then you might be totally fine and you could honestly probably live with it. But I think if it is becoming a hindrance, to me, it sounds like you should definitely seek more than one opinion from a professional. If you are and say you have this, or just any kind of like neurological thing, definitely seek out more than one professional.
For sure. Yeah, and I think getting a second opinion, if that's possible for you, is definitely a good idea. Because even if we kind of go out of the ADHD realm for a second and just talk about like the medical field as a whole, I don't know if you've seen in the news, there was an artist who created diagrams, medical diagrams and graphs featuring, for example, Black people. And for a lot of doctors and medical students, that was the first time they had ever seen Black people represented in medical like textbooks and things like that. And it was their first time like knowing how to recognize certain skin conditions on Black skin, because everything they had always seen before in the textbooks was always on white skin. So if you think about that, like it's 2023 and we're just now realizing in the physical medical space that we need to address that. You can only imagine like where we're just now getting when it comes to, you know, mental health and the diversity of that as well.
Yeah, and then I think it's pretty well known that the medical study of women in general is very behind. There's so many things that they can't quite seem to figure out when it comes to women, and we've been here for a very long time on this planet. Yeah, and it's almost like when you open your history book and it's like the Egyptians and it's like a blonde guy with blue eyes.
Yeah, they're actually saying I think like 1989 was one of the first years that they did medical research on women, because up until then it was just like all men, unless it was, you know, specifically something that women experience, which is just crazy. So it's very recent, you know, that we're making these advances.
that, yeah, that's insane to me. Because women are the majority of the population in general. No, it's very behind. Um, so with women of color, does the underdiagnosis of women of color also kind of have to do with some of the inequalities in healthcare,
Yeah.
you find?
Yeah, for sure. I mean, um, if we're talking about inequalities in healthcare, that can definitely present in so many different ways, whether it's access. So, like, if you're living in an area where there's just not a lot of medical professionals you can even go to, or maybe there are, but then you can't afford it. Like, there's just so many things. And also, kind of going back to what we were just saying about we're just now like realizing, oh, we should do research on women. We should do research on women of color. Um, medical schools too are just now introducing culturally competent curriculum or curriculum, I guess you would say. So that definitely, I think, contributes to the overall underdiagnosis of women of color with ADHD for sure. And then also just when it comes down to trying to access medication or therapy or whatever sort of treatment that you want to like go down that path, that can also have its own barriers. So it's not to say that, if you're a woman of color, that it's impossible for you to get diagnosed or to get treated, but there are, sadly, likely going to be more barriers that you have to.
Yeah, I think that's because your barriers are cultural barriers, then you have financial barriers, and then potentially a language barrier.
Mm-hmm.
It just becomes there's so many hurdles to just there could be so many hurdles to just kind of learn more about yourself than there should be. And I think that can be very disheartening for a lot of women. So I think obviously you're a great resource, and chats like this, there needs to be more conversations about how to diagnose yourself, what it is, what you should look for, any tips and tricks people have.
For sure.
Because they're stuck with this like inkling that like there might be something, but like my mom says I'm just moving too much, or like
Yep.
Yep.
Hispanic moms will always come up with their own theories and their own, explanations for your behavior. Well, we love them anyway. But yeah, it's also interesting that you bring that up because it makes me think a lot of times the barriers you face might even show up even before you go to the doctors. Like you said, the cultural aspect of our relatives thinking like, no, we all do that, or it's not really like ADHD isn't really a thing. We're just, making that up. But also I think with that, one thing that I've experienced and also a lot of other women have experienced is like growing up, we always attribute our difference or the reason why we behave differently from our peers on some other factor. So like for me, I thought I was always a little bit different and didn't like totally fit in with my peers because I'm multiracial. Mm-hmm. And so that was kind of my explanation for everything growing up. And then later on, I found out it was actually, it was partially that, but it was also ADHD. And I think for like other women of color, they might, feel like they're different from their peers because they are like culturally different, not realizing that there's this added layer of being neurodivergent. So they might even count themselves out before they even fully consider like all aspects of their identity.
Yeah, I think that's so interesting because one thing that I struggle with, because I feel like, and I do it all the time, which I feel like I can't imagine it being a good like conversation to have all the time, but I find myself either frequently saying like, oh, I have like some OCD, or like I'm a little ADHD, or I'm a little ADD. But that's common terminology that I hear so many people saying. That do you find that I can never tell if that is disheartening to the ADD or ADHD community, or if it's one of those things where I am speaking it out loud, but I'm yet to, because I think I have, like, because in my heart of hearts, I think it could be a thing, and I just haven't seeked out the coaching right. or anything like that. Yeah. I can just tell.
Yeah, no, I think you bring up a really good point. I think there is a difference between using all of these mental, like developmental disorders or conditions in like a flippant way. You know, if you just wash your hands really well and then you're like, oh, I have OCD, like that's not, you know, necessarily. Yeah. But if you, like you said, think genuinely you might have OCD, but for whatever reason you haven't been able to pursue that diagnosis, I think there is still something to be said in support of that, because it can be like reclaiming or just recognizing that part of your identity. It can also be, you know, recognizing the systemic barriers that might be preventing you from getting that diagnosis. So I think there is a difference, and sometimes the boundary might be a little bit, you know, confusing, but you know, that's not to discourage you from pursuing a diagnosis if that's what you think is best for you.
Yeah. So Glenda again, she says, I think it's a really great topic, especially in education. Sometimes as teachers, we may categorize a student as misbehaving, but in reality, they may need our help or assistance and assistance.
Yes.
And I don't know if you've ever been in this conversation, in this position, but if you are an educator, and you potentially have a student that you might, or if you know someone that you might have an inkling might have ADHD or OCD or anything like this, is there a correct path that one can take to kind of parents or someone?
Yeah, so it's a little bit complicated because I feel like that's when you see the convergence of all the things we've been talking about. Because, for example, my sister was an elementary school teacher and she had some students with ADHD that were diagnosed and others that weren't, but she kind of felt like they were. For the ones that weren't diagnosed, you know, her first course of action would be to talk to the school nurse and to try to set up a meeting with the parents to see if, you know, pursuing a free diagnosis through like the special program they had was something that they would want to do. Sometimes the parents would say yes. Other times the parents really just did not have the capacity or the desire to handle that. So at that point, unfortunately, it gets a little bit, you know, more complicated, because it's like, what can you do when obviously this child is still under the legal protection of other parents? But assuming, you know, you do have a child where the parents either want to pursue a diagnosis or you just feel like there's a way you can help them, I think there's ways that you can make the classroom more accessible for them. So building in more like active time in the lesson if that's possible, so that they don't have to feel like the odd one out for fidgeting, or, you know, if the lesson really does require them to sit there, you know, giving them like a little fidget toy. I know fidget spinners were like a huge controversy a few years ago, but there are definitely quieter, less distracting fidget toys like little fidget rings and things like that. So I think looking for those little changes that you can make in your classroom can really make a huge like ripple effect difference for your students.
Yeah. Do you think something like creating healthy habits, like creating essentially like a task list or something where they can get in the process of slowly, essentially if they're getting overwhelmed with maybe what they have to do, where it's kind of these healthy lists that they can slowly kind of pick away at?
For sure. Yeah, I think it's really helpful if you can teach kids with ADHD how to prioritize tasks, because as we were saying earlier, sometimes like we just think it's a lot bigger of an issue than it really is, and once we get started on a task, we're like, oh, this wasn't so bad. So helping kids come up with those lists, know how to prioritize and work through them. I think another thing that's really important is really emphasizing like positive reinforcement for kids with ADHD, because a lot of times our brains, like the dopamine receptors, the thing that, you know, triggers like your reward and pleasure senses, it's just kind of imbalanced in the ADHD brain. So if you can find ways to make them feel good about themselves, that's going to really help. Because studies have also shown that children with ADHD, whether they were diagnosed or not, in childhood, they will often, by the time they're adults, have received, I think, like 20,000 more negative comments about themselves than children who do not have ADHD. And you can just think about, like, if people are constantly looking down on you, saying bad things about you, saying like, oh, you're lazy, you're distracted, all this and that, that's really gonna like hit your ego, and you're gonna really have self-esteem issue going into adulthood. So I think just focusing on ways that we can really encourage and build up children with ADHD, as opposed to like always, you know, punishing or yelling at them, is key for kids with ADHD and really just kids in general.
Yeah. I think that would also help fight the stigma of ADHD, really taking make it in a more like, all right, this is a more productive method versus like kind of tearing the kid down. All right, and then Let's Dish says, are there any books that you would recommend that would help someone learn more about ADHD?
Yeah.
Or I guess resources in general.
Yeah. In terms of resources, Brittany Janine is a creator here on Instagram. She's also a coach, although she does a different type of coaching, but she has ADHD and she creates a lot of great content surrounding that. Actually, ADHD is another really great Instagram page to go to for more resources. Of course, my page, just gonna do a little plug right there. But also in terms of like books, the first one that comes to mind is Hunters in a Farmer's World. So that one kind of talks about like the initial theories behind where ADHD came from in the first place, like in the history of humanity. And of course, there's like some debate about the theories in that book, but I think it does open up a really interesting conversation about where does ADHD fit in our modern society? If society had been structured differently, would we see ADHD as being a problem, or would we see it as more of like an asset? So it's a really interesting book. And then I think the magazine is called Attitude, but it's like ADD-itude. That's an ADHD magazine, and that's also really helpful as well.
That's great. We'll, for people listening, we will share that on our Instagram for everyone. And then obviously share Victoria's, all her info so we can plug you away.
Yes, thank you.
So with that being said, do you have any other kind of closing statements? Does anyone listening have any additional questions?
Yeah, so we'll wait to see if any comments roll in. But in terms of like a closing statement, I feel like in this discussion, we've definitely talked about a lot of the struggles that come with either having ADHD or with how you're perceived and treated in society. And of course, like I want to acknowledge and hold space for all of that. But I also don't want people to come away from this conversation thinking that like ADHD is inherently a bad thing or that it's always, you know, a struggle and that there's no upsides. Honestly, I think there are many good things that come from ADHD. I feel like it makes me more empathetic. It makes me more creative. I just, even if some of my decisions are sometimes impulsive, I have a fun time anyway. So it's not all bad. And I don't want people to feel that way about it at all. So yeah, I just want people to see ADHD as like holistically and realistically as possible.
I feel like ADHD is, or I think, yeah, ADHD I think is so fascinating because I think your brain, you're producing so many thoughts or you have a need to move. There is something really beautiful about having it, and I think it is really just kind of fighting the stigma, whether that's culturally or societally. And then, yeah, learning more about yourself. I think if you were a child that was constantly told you're misbehaving, then, you know, it's kind of reteaching yourself that, oh, I'm not bad for acting this way. And yeah, I'm trying to see if someone, I don't know, hope. Yeah, I don't think there's nothing wrong with having it. Like you said, it's just kind of finding the right tools and methods to kind of educate yourself, educate your community, educate your kids. And that's why events and people like you are so helpful and so important.
Thank you. Yeah.
It's a huge thing. And it's a big fact of just society now.
For sure. Yeah. Oh, I just saw a new question. Let's see.
Oh, don't feel stupid. That's why we're here. I feel like almost weekly people are telling me that I have ADD for like my little tics and like the things I have. So it's one of those things that also like it leaves me personally questioning, do I have this or do I not have it? Am I quirky?
Yeah.
Like, is this just my personality? And there's nothing wrong with that. I feel like that's why people that like love and cherish me because it's just the way I am.
Right. Yeah.
Or not, and that's probably exactly the same thing as you.
Yeah, for sure. And I mean, to just respond to this person's comment, like I think when you're first diagnosed, especially if you're diagnosed, you know, in adulthood, there's a pretty common cycle we all go through where it's like, on the one hand, relief. You finally have this answer, and you're like, this big question, you know, I finally know like what's going on with me. But then it's almost like the 7 stages of grief where you also are like, how could my life have been different if I knew this, you know, way sooner? And how could I maybe even raise differently and, felt better about myself. And then even anger, like I wish I had known sooner. I wish I could have been treated better, things like that. So everything that you're feeling to this person who commented, totally valid. But it doesn't actually mean you're stupid. It really just means that you're on this amazing new journey to knowing more about yourself and finally knowing how to work with yourself instead of against yourself. So yeah, but congratulations on being diagnosed. Welcome to the community.
Yeah.
And there's another comment. So as maybe late term ADHD, what would you say to respond in a more positive way? Ooh, good question. So how to respond in a more positive way about ADHD? Again, I think this is going to be different for every person based off of, your own personality, your own symptoms and everything like that. But like for me personally, when people kind of have this negative view of ADHD, I'm like, well, it's really not inherently a bad thing. It's just one of the other many differences we have in our society. And I feel like it actually benefits myself and other people because I can't tell you like how many times in school I had a project and a group project and everyone just could not think of the solution and they were just like stuck on the most routine expected solutions. And then I would come at it with like the most, out of the box, like crazy idea, and then it would work. And I think that's partially due to my ADHD, like just making me more creative and, making me connect ideas in ways that other people don't always. So I think you just have to do some like internal, like investigation and figure out what are your symptoms, what are great instances in your life of your ADHD benefiting you and maybe by extension benefiting others.
Yeah. And I think kind of following up with that, I feel like it's really all about the way you kind of speak to yourself too. And it's kind of reteaching yourself that these things aren't bad. Just learning more about yourself. So someone also said, so same person who just got diagnosed, I'm currently not on medication. I've been looking into it. I'm just scared of the side effects.
Yeah, honestly, valid concern, especially if you're someone who has been on medication for maybe other conditions before and had a bad experience with that. I mean, I definitely don't want to, make anyone feel like medication has to be the answer for them. If it's something that you're still interested in pursuing, I would, like I said earlier, hop on those Facebook groups for women with ADHD. There's so many threads about different medications and how people respond. And I think it's really helpful to have that like firsthand just data on how everyday women do actually like react to certain medications. And then be sure to have just really in-depth conversations with your doctor, even get a second opinion if possible. And don't be afraid to like bring anything you want to the table. If it's a prior medical experience, if it's a concern you have about a particular side effect, or maybe how it might interact with like another medication you're taking or another health condition you might have, feel free to bring all of that so that you can make the most informed decision for yourself. And if at the end of that you decide medication is something you want to try, that's great. If it doesn't work out, you can always just stop medication. If you decide you don't want to try medication and want to try another route like therapy, that's also a totally valid avenue as well. So whatever you end up deciding, like it's definitely just going to be what's best for you, and there's no shame in that either way.
No, I think that's great. Okay. Any other questions?
Yeah, thanks to everyone who commented, by the way. Those were like really great questions.
I feel like this is so helpful and just so informative because no one really talks about it.
Yeah, for sure. We're like just getting started, so it's really exciting.
Scratching the surface. All right. Well, if anyone has any other questions and we don't hit them today, please feel free to message LTN. We will follow up with Victoria. If you thought this event was super helpful, please let us know, and maybe we can schedule another one.
Sure.
We can do kind of anything. We will have the event will be recorded. We'll have it posted. We will share all of Victoria's information. Vici's coaching, we'll share it all. Her resources, we will share. And yeah, if you are willing, we could share your contact, your email, your Instagram. We can plug you away. So if anyone wants to kind of reach out to you directly, they definitely can. Yeah, and do you have any closing statements you would like to make?
Yeah, for sure. So like for anyone that like watched or left a really insightful comment or question today, feel free to follow me over at Vici Coaching. So that's VICI Coaching. here on Instagram just for more consistent social media content regarding like ADHD and specifically how it intersects with your communication style. You can also always email me at Vici Coaching. So again, VICI coaching@gmail.com. And I also currently have one spot open for one-on-one private coaching. So if you're someone with ADHD or you suspect you have ADHD and you want to learn how to become a stronger writer or public speaker, times for my clients, that means that they're working on like a really long academic paper or they're trying to improve their professional communication for whatever their job is. Feel free to go to the link in my bio and just sign up for a free clarity call. So yeah, but thank you so much for having me and for everyone who watched.
Yes, thank you everyone so much. This is so great. Follow Tien, follow Vici Coaching, and yeah, have a good night. Thank you, Victoria.
Yeah.
All right, bye everyone.